We're going to hear from Dr. Kamran Khan about another aspect of health and mapping, and the way in which he and his colleagues in Toronto have used GIS tools to understand global flows and interactions of exotic diseases, of world travel, of populations on the move around the world, and how this has become both a medical cause for him and a sort of public engagement, public organization cause. Dr. Khan, he is an infectious disease physician with training in public health at the Li Ka-shing Knowledge Institute of St. Michael's Hospital in Toronto. As you'll hear, he's somebody who's ended up where a lot of big, dramatic diseases are happening. There was a story recently in the New York Times that said about him, Dr. Khan says he has a bad habit of being around emerging diseases. He's worked on the front lines of the 1999 West Nile virus outbreak and the H1N1 pandemic of 2009. But the event that hit closest to home was when his own hospital in Toronto was affected by a deadly outbreak of severe acute respiratory syndrome, or SARS, which hit Toronto hard in 2003. From that experience, Dr. Khan learned a lot about the way you can use geographic tools to understand public health, and he even started a new organization to put these tools to work. Please join me in welcoming Dr. Kamran Khan.
Jim, thank you very much for that introduction. And as Jim mentioned, one of the things that really had a profound impact on me as a clinician was this outbreak of SARS in Toronto in 2003. And I'm going to talk about how that really shaped the way that I think about health and how GIS really had a profound impact on the way that I practice medicine, my role as an academic and a professor, and then more recently as a founder of a social enterprise called Blue Dot. So I'm going to start out here with an image, and I think this will be apparent to all of you that we're looking at a map of the world. What is a little bit unique about this map is it's actually just 65,000 lines, and each of these lines reflects the flight paths of a commercial aircraft going between cities that have commercial airports. And I think this has been a really, it's a very interesting image because I think it shows you just how connected the world is today. And I have been very, very interested in studying this network, not only in terms of how it binds us and connects us as a global community, but also how it actually can serve as a conduit for the spread of potentially dangerous and deadly infectious diseases. Now, many of you, I imagine, in this room here as executives and people in business spend a lot of time in airports and in airplanes. One of the things we wanted to do was actually just to quantify exactly how much mobility are we talking about in the world today. We have, as individuals, have now started to become the main vectors that are carrying these diseases to different parts of the globe. So how much have we actually traveled? Now, I've been studying this network for over a decade and actually partnering with the global airline industry to study and analyze the flight itineraries of almost every person who boards a commercial aircraft in the world. Now, this is anonymized, so I don't know where you've been or where you're headed to, but we can actually understand how the world is moving. So last year, we actually analyzed over 4 billion flight itineraries to just quantify how much movement are we actually talking about. So this is the number. It's not as many zeros as we had in the earlier UPS presentation, but this is nearly 6 trillion kilometers. So if we're thinking about how far we have moved through commercial aircraft in just a single year, this is an enormous distance that we're talking about. Now, if we try and even conceptualize, well, what is 6 trillion kilometers? You can't even imagine it on a global scale because it's far too large. You have to start thinking about it almost on an interplanetary scale. 6 trillion kilometers is traveling from the Earth to the Sun and back 20,000 times. So this is a very, very significant amount of distance that we have here just on this little rock. And I should point out to any of you who do not have your air miles signed up yet, you should really consider doing so because there's a lot of free trips to Hawaii that you could take advantage of. But regardless, this is a lot of movement. And even if we put it on an interstellar scale, this is 0.6 light years that we're talking about. This is actually about 1/6 of the way to the nearest star, and that's all the movement that we have on this little planet that we all inhabit. Now, with that interconnectedness, we get economic benefits and social and cultural benefits of being part of this global community, but there's also an interdependence that comes with this as well when it comes to health. We are now increasingly connected to the health and well-being of every other person on the planet. In 2003, as Jim had mentioned, I had just finished my training. I had moved up from New York back to Toronto, which is where I'm from, and we had the SARS epidemic. And it was really a very disruptive event. We had an outbreak that lasted several months. As many of you may recall, this outbreak actually spread to dozens of cities and countries around the world. We had a particularly bad outbreak in Toronto, where we had several hundred cases. We had 44 deaths, including in frontline healthcare workers. And it cost us $2 billion to get this outbreak managed and under control. And in fact, actually, it took 5 years before people started returning to Toronto after this outbreak, because really this had in some ways impacted the brand of the city after the World Health Organization issued a travel advisory against travel to the city of Toronto. And so looking at that event as a new clinician, as an academic, I think there was a realization that there was probably more to come. And sure enough, 6 years later, we had a flu pandemic that emerged in Mexico, spread across the entire world in record time. In the span of just about 2 months, every single country in the world had H1N1. I think everyone here remembers the 2014 outbreak of Ebola in West Africa. Over 10,000 people died in that particular outbreak, and we had the spread of this disease to a handful of countries, including the United States. And more recently, in 2016, we saw something that we never really imagined before, a virus that has spread through mosquitoes that can affect children in the womb and cause severe birth defects. And this here is a child with a condition called microcephaly, which would of course have lasting permanent health and neurologic conditions. So the question that I've been asking myself as a clinician, as an academic, and more recently as an entrepreneur is, well, where are we headed? And how well are we prepared for what lies ahead in the future? Now, as a physician, this is what I'm trained in. I'm trained in understanding the human body, anatomy and physiology and so forth. And as I started to look at some of the data studying the global airline transportation network, essentially as a living system, I began to see some parallels with my training in medicine. So when I walk into the intensive care unit and I see a patient, I see a tracing that's probably very familiar to many of you. I'm looking at how my patient is doing. I'm seeing whether or not there are any abnormalities there that may give me some insights into their health. And then when I started analyzing data on how people move around the world, I started to see another pattern. This is people, this is instead of blood flowing through a person's artery, these are people flowing through an airport. This is Vancouver. And you can start to see again a physiologic pattern here. A very similar, this is over 10 seconds, this is about 10 years, but you have the same kind of physiology. And so the thinking here was maybe there are insights that we can gain if we are, metaphorically thinking of the planet as our patient. Maybe there are ways that we can gain insights into what is happening around us. So there's a little arrow here, which is actually a blip that shows us what happened post 9/11. And then we have another blip here that maybe is a little less apparent. You can see it easily in a time series analysis, which is the SARS outbreak. So if we, again, wanted to go further and try and see if we could think of the planet as our patient and try and understand what are the illnesses or drivers of the emergence and the spread of dangerous infectious diseases, how would we do that? So what we realized is we were going to need a lot of information. Now, in the same way I had to study endocrinology and gastroenterology and cardiology to think about my patient, we would need to be gathering information on various different aspects of our global community. We'd need to be thinking about microbes and where they happen to be, where are they normally found, where are outbreaks happening around the world in real time. We need to understand demography. We just heard a little bit about that in our previous presentation. Some diseases affect people who are elderly, others for individuals who are pregnant, or people with weakened immune systems. We need to understand the demographics of the populations that may be vulnerable. And we don't often think about animals with respect to human infectious diseases, but most of the emerging diseases that we see, whether they are HIV or SARS or Zika or Ebola, these all have their origins in animals, and we have become essentially infected as humans, and then these diseases have propagated. So we need to understand something about livestock and wild animals and their health as potential sources of diseases in humans. Insects. We have become very acquainted with the mosquito Aedes aegypti in relation to the Zika epidemic. This is the main mosquito that is found throughout many parts of the world and can transmit this particular virus. And we also need to understand environmental conditions, the temperature and the vegetation and the humidity and precipitation that influence the life cycle of this particular mosquito. We need to understand something about health systems and their capacity, transportation networks, and so forth. So what we are really dealing with, if we wanted to try and look holistically, and I think we heard Jack talk about a holistic perspective earlier this morning, is that we need to have this diverse view of what is happening in our world. And so we've used GIS really to start to understand the relationships. I think integration was a word that I heard as well this morning. And this is the challenge of how do we take all of this data, which has a lot to do with where are the insects, where are various microbes, where are people, where are certain climatic conditions present, and how do we start to weave that together? And this is where GIS has been such a profound tool for us to be able to integrate and weave that information together. The other part of integration that I think has also been very challenging is the semantic integration. What I mean by that is, what does this mean? Data is just data. Knowing that there's an insect, knowing that there happens to be certain climatic conditions, that has to mean something, and we need the subject matter experts who can actually bring all of that together. So as a clinician and as an academic, I knew that this was going to be a really big challenge to take on through that particular sector. And so a few years ago, in 2013, I founded a social enterprise called Blue Dot. And we are a deliberately eclectic group of people. We're about 50 employees today, so a fairly small organization. But we include physicians, we have veterinarians, ecologists, epidemiologists, data scientists, software developers, designers, and we have one single goal, which is really to try and use information to help us be better prepared for and responsive to the next types of threats that we will inevitably see in the future. Now, if you're wondering where we got our name Blue Dot, it actually comes from that pixel. That's what we're named after. And this is what Voyager, as it was leaving Voyager 1, was leaving the solar system in 1990. The late Carl Sagan asked NASA to turn the satellite around one time and take a look back. And I think what this really depicts is the humility of just how small the world is and how we are really all in this together in terms of our future health and our well-being. So what has Blue Dot been trying to do in terms of distributing insights to different audiences? There are really three main groups that we're trying to engage. The global public, and I'll explain a little more in a moment. Healthcare providers who are on the front lines. When somebody walks into the emergency room with an unusual disease, they have to be there to make that diagnosis in a timely manner. And governments that make policy decisions around interventions to respond to public health emergencies. So before I get into this image here, this is, I'm going to describe a little bit of the work that we did in anticipating the international spread of Zika virus, and proud to say that as an organization we were able to produce this type of assessment even before the World Health Organization had announced that there was a global emergency. What I'm going to do first is I'm going to tell you a little bit about how Zika virus spreads, because it will offer some insights into what we're doing here. Now, Zika is a very interesting virus in that when a mosquito is carrying it, if it happens to bite a person, that person after a few days will become viremic, meaning that they've got the virus traveling through their bloodstream. Now, the mosquito doesn't travel and fly across continents from one place to another. It's people who actually travel through airplanes, carry the virus in their bloodstream. Now, when they get to their destination, if they have a mosquito like Aedes aegypti present, that mosquito will bite them, ingest the virus into their gut, and then after several days, it will migrate from its gut up to its salivary gland. When it does that, it can then bite another person, and it can now carry this infection on to the next person. So the reason I mention that is because temperature is one of the biggest drivers of the mosquito's lifespan. If it's too cold or too hot, the mosquito will die and it will not be able to transmit this virus. So what we had done is we had worked with our colleagues at Oxford who'd spent a lot of time studying Aedes aegypti, this mosquito, and incorporated climatic data to model essentially in dark orange the areas where local transmission of Zika virus could be propagating. And this was very important because the world had never really seen Zika in any significant way prior to this. There were no commercially available diagnostic assays, so we were kind of looking at this blind. We didn't really know where the cases were. So we had to try and model and estimate where Zika virus was most likely spreading within Brazil. I do have to point out, I was actually in Recife up here at a meeting for preparing for the 2016 Olympic Games with the Brazilian government, when in fact there was this syndrome of fever and rash and respiratory, fever and rash and joint pain, which actually happened to be the beginnings of Zika virus. So wherever I happen to be traveling, I would suggest that you probably want to go in a different direction. Now, how did we use GIS here? What we did with these orange areas is we overlaid data on the world's commercial airports, which we've been working with for over a decade. So within 100 kilometers of any orange area, you can see every commercial airport in Brazil. We then took that data, analyzed the flight itineraries of every person leaving, and we wanted to see where their destinations were. And these are not just the aircraft, but these are the actual tickets of the individuals, anonymized, but we can see where they're actually going, where they're making flight connections, and so forth. And then we mapped out the final destinations of where they were headed. This is something we published in the medical journal The Lancet, as I mentioned, in January of 2016, well before the declaration of a global emergency. What you can see on the receiving end is we've got a lot of people who are potentially viremic, who are going to be going into southern Florida and places like New York. Now, New York doesn't necessarily have the conditions for local transmission of Zika virus, whereas Florida does. So we had really anticipated that we were going to see later in the summer local transmission of this particular virus. And you can see here through this type of visualization how we worked with our colleagues at the US Centers for Disease Control and Prevention in Atlanta through a program that was called Mosaic, collaboratively to use this type of information to support decision making by senior health officials, not only in the US government, but also with colleagues that we have and partners that we have in Southeast Asia and in other parts of the world. And lo and behold, what we did find was actually Zika virus transmission 6 months later in parts of Miami. Now, as we looked at this, the first scale of our assessment was really at a global level. Where might this virus go and which types of communities might it affect? But when we started to see Zika virus in places like Wynwood County and some of the other selected areas of Miami, we started to ask ourselves, well, could we do better? Is it possible we could start to predict and anticipate where this virus might be spreading within the city? Now, our flight itinerary data gives us this global perspective on human movements at a global scale, but it doesn't offer us information at a local level. So what we, I think you heard a question earlier, how many of you have a smartphone? I think it's really who doesn't have a smartphone these days. And The Economist has projected that just in a few years, in 2020, 80% of every adult in the world will probably have a smartphone in their pocket. So we've now started to partner with major telecoms. Here we're partnering with this is not a picture of Florida, this is here of the city of Toronto. We're partnering with an organization called TELUS, they're one of the major telecoms in Canada. And now we're starting to be able to look at the movements of people, again in an anonymized way, across the entire country and potentially even across the entire globe. Where were they? Were they in an area where there was an epidemic underway? And if they walk over or head into Toronto General Hospital, what insights might we be able to deliver to the healthcare providers themselves? So they're anticipating what kinds of risks they may be facing. And this is one of those areas, again, where our partnership with Esri has been so important. How are we going to deal with the massive volumes of data that we are facing? And tools like Insights and GeoAnalytics Server and GeoEvents. This is how we can start to use these tools to draw insights from this type of information. Now, I'm going to shift gears a little bit and talk now not necessarily about governments, but healthcare providers. And there is an adage in medicine that most physicians, particularly I would say in North America, have heard, and it comes from Dr. Theodore Woodward, and it was first coined in 1948. He was telling his residents and his interns that when you hear hoofbeats, think of horses, not zebras. And what he really meant by that was, you know, common things are common. Don't think about the exotic disease, just think about the more likely disease, the more common disease that we see in our neighborhood. And I think that probably worked very well in 1948, but fast forward to 2017, this actually doesn't work all that well, and it's potentially dangerous. One of my colleagues actually got infected with SARS and wound up in the ICU because they were thinking horses, not zebras. They were thinking it's probably influenza, but it turns out that it's a coronavirus the world has never seen before. And so this is one of the challenges that we face. We're creatures of pattern recognition. And so at Blue Dot, one of the things we've been working on developing in partnership with the Canadian Medical Association, which represents the 80,000 physicians across the country, is how can we spread knowledge faster than disease? We know that a person can get on a plane and travel halfway around the globe very quickly, but information can actually go even faster than that. So if we imagine that there's an epidemic here occurring up in this upper left corner here, and you now have one of those individuals who maybe inadvertently is incubating or carrying a particular disease, if they travel over into this area in red, and the healthcare worker just lacks awareness of the epidemic, they're not even thinking about it, maybe they don't even know about it, that it's very possible that they're going to think about a horse and not a zebra. They're going to miss the diagnosis, and if this is a contagious disease, one case may become 10 cases or 100 or 1,000 or more cases. And this is the danger that we potentially face. And you can imagine for every healthcare provider, they're focusing on the latest guidelines on managing hypertension and diabetes, not necessarily on the one out of several hundred health events that are being reported every single day around the globe. So what if we could direct information to a healthcare provider and give them a heads up, so to speak, based on their location? And so this is what we've been working on, understanding and managing all of these hundreds of different events that are being reported around the world every day, clusters of meningitis, clusters of measles, mumps, and so forth, unusual febrile respiratory infection. And based on the location of a physician in their phone, we can actually, and have developed proximity algorithms to say, well, what's actually physically in your neighborhood? And how are you connected to every other city in the world through the movements of people through international air travel? And give them a little bit of a heads up. The delay in diagnosis for physicians tends to be that they're not thinking about the disease, not that they don't have the test available or they can't do something about it. It's just that it's not center of mind. So Zebra is one way that we can use GIS and location to actually pass information to people faster than the movements of disease itself. Now here, I'm going to go on and talk about the global public, and I think this is a really kind of lovely passage from the Talmud, concept here that whoever saves a single life, it is considered as if he has saved the entire world. And when we think about infectious diseases in individuals and the next outbreak, we don't know actually who that person is going to be, maybe inadvertently, who might transport a virus or a new disease to another part of the world that causes a very dangerous and very deadly epidemic. We don't know who that is. And which one of these individuals might it be, and then who's going to get on an airplane and travel halfway across the globe and start to disperse and disseminate this particular disease. So what we really want to try and do at Blue Dot is to see if we can actually channel information and direct it to individuals. So we developed a mobile app called George Health, which is, George Health Companion, which is found on the App Store or Google Play. And this is a way that we can deliver personalized, location-based information to anyone wherever they are in the world. So if you're pregnant, or if you happen to be, 65 years of age and you had a liver transplant, or whatever it might be, we're now personalizing this information to you wherever you are, so you can understand what steps to take maybe before you travel, or failing that, if you don't have time to take necessary steps, what do you do while you're there to minimize the health risks? So we're watching out, essentially looking at what's happening around the world, not only in terms of outbreaks, but in terms of background diseases, so that you can actually have this information at your fingertips. If every person is less likely, or if even 10% of the world is less likely to become infected, that actually can translate into an important improvement in our overall global well-being and security. And because infectious diseases are creepy, for a lot of people, we've had our designers working on ways that we can try and lighten things up a little bit, try and engage people, appeal to their own self-interest of protecting themselves, but also when they protect themselves, they're protecting all of the rest of us locally and globally. So recognizing we're coming up on lunch here, I think what I'm going to just do is say, what is next for us? I think what is really exciting is this program that we're building in big data GIS and health emergencies. And we want to try and use this very diverse sets of data. This is less about volume of data, it's more about the variety of data that we're dealing with. And that's the big challenge for us. How do we integrate it spatially? How do we wield it? And how do we use it to respond and better prepare for inevitable health emergencies that in fact may be global in the future? Mobile technology is a real central part of all of this, not only in terms of gathering information to understand how people are moving and consequently how diseases are moving, but also as a mechanism to distribute insights back to individuals to protect themselves. I think earlier this morning we heard that leaders want inputs and the public wants information. This is essentially what we're trying to do, have this two-way pathway of collecting and gathering information and distributing insights back to individuals. And of course, with all of this data, I come from a classical epidemiological background in terms of my training, but we're starting to think more about how we can look at data-driven insights and using things like machine learning and artificial intelligence as a way to scale the impact of what we are able to glean and to understand, and how we may be able to disseminate that to a much broader audience. So I want to end just here with a picture. It's a young child who was unfortunately been born with microcephaly, and I think purpose was mentioned at the very beginning of today's session this morning. And I think for me personally, this is something that really has a tremendous sense of purpose of how we can try and use information and use GIS to try and create a healthier and safer world. So thank you very much.